Close this. Oh. I think it's on. I'm not sure. Tracy.
Hi, Emma.
Hi, can you hear me?
Yes.
Very good.
Before starting the session, I will play an introductory video. Then you can start your speech.
Okay, thank you.
Okay.
I'm introducing Emma J. Norfleet. Emma Norfleet is the president and CEO of Haley's Mind of Case Services LLC. She is a psychotherapist, motivational speaker, and author with several Amazon #1 bestseller, co-authored book anthologies with Dr. Cheryl Wood and Dr. Les Brown. Recently authored How to Unmask and Resolve Trauma in February of 2022. Dr. Emma Norfleet and her staff provide evidence-based psychotherapies that help clients trump over trauma. She also facilitates CEU training for clinicians needing licensure or licensure renewal. Mission to help thousands that have survived trauma learn how to trump over trauma. This is the introduction of Emma J. Norfleet. Thank you. Thank you. Thank you. Hello. 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 Hello to all. It is absolutely my pleasure to serve you. Now, today, you all, it's a presentation, but we're really going to have a conversation. We're going to have a conversation about something that has been my purpose in life for the past 2 decades. I just didn't know part of what that purpose was until it was revealed to me. So now that I'm walking in my purpose, because trauma is global, I have to be global. So, with that being said, you all, I'm going to get started. What you heard Miss Rohr talk about was the titles and all of that stuff. But I want to tell you what I do. See, what I do is I help people learn how to make their triumph greater than the tragedy or the trauma. I want to start you all today talking about statistical data. And I am going to give you some alarming statistical data. For example, did you know from the age group 1 through 46, the number one cause of death, trauma. The number one cause of death is trauma. Also, did you know that trauma is at a cost to not only the person that's experiencing the trauma, but trauma is a cost to the citizens as well, taxpayers. So, what we have to do, you all, in this great nation that we live in, is that clinicians like myself and those of you under the sound of my voice, we're going to have to get a little more serious about trauma. The CDC and some of the other places where I've done research, they have alarming statistics as well. And part of what I want you to know, in addition to trauma being something that's the number one cause of death for that age group 1 through 46, I also want you to be aware that the annual toll of trauma in the United States is, guess what? $4.2 trillion. Yeah, I said $4.2 trillion. With that being the case, I want to make sure I keep up with my time here. See, it's 7:26. Okay, that being the case, you all, another alarming statistic that I have is that the total NIH funding, National Institute of Health, of all of their budget, there's only 0.02% dedicated for what? Trauma. So I hope by now you're catching the trend that I'm talking about right here. This is a grave problem that exists in society and global because guess what? Trauma does not discriminate. It is global. It's going to impact as it's going to impact lots of people. One of the things that I want to bring to note now before I give you the other statistics would be about the pandemic. So for those of us who were already dealing with trauma or not dealing with it, the pandemic exacerbated existing pathology where trauma is concerned further. For example, did anyone think that we would be living in a time where we'd be walking around with masks on our face? When that first started to happen, some almost 3 years ago now, you all, I remember watching an Alfred Hitchcock movie. And in that Hitchcock movie, there was these people that were walking around with masks on their face. And so I remember at one point during the beginning of the pandemic, walking out into that and having and raised anxiety and being definitely aware of that raised anxiety. So what it did for me as a clinician, I'm like, okay, so if anxiety within you who has not been diagnosed with PTSD or having any type of an anxiety disorder, what do you think that it's doing to your clients? That being the case, you all, I am dedicated to this mission because trauma will keep coming for you. Now, what I am going to do is today, hopefully enlighten, bring awareness, talking about the statistical data to help you understand if you have not dealt with your trauma, it's not going anywhere. The other alarming statistic that I want to give to you is of that trillion, 4.2 trillion, the annual cost to society for these anxiety disorders is estimated to be significantly over $42.3 billion. That's a lot of money. So it's at a cost for the person's mental health, and it's at a cost to the taxpayers. It's a cost to, guess what? Work environment. If you're not dealing with your trauma, and let's say you're on your job and you're triggered by different things, yeah, that means you're not at work. That means for that particular position, nobody's doing that work. So therein lies, you all, in this quick, brief introduction about trauma that can be what? Emotional. Trauma that can be physical. Trauma that can be environmental. Now, when I say physical abuse, when I say physical trauma, we're talking about things like could be physical abuse, sexual abuse. That's physical. That's an example of. When we talk about emotional abuse, we're talking about maybe domestic violence, void the physical contact, because that would fall under the physical violence. But there is a berating of sort that goes along with domestic violence. And sometimes, if a person has watched their parents have a domestic situation and then they find themselves thinking that this is what relationships are about, that can bring about a traumatic experience relived in your current relationship. So, with that being the case, that's the example of the emotional abuse. You then have the environmental abuse that falls under like tsunamis, mudslides, fires that happen, those dry fires out there in California, you all. So, with that being the case, trauma is something that in the past we oftentimes thought of it as what? The veterans. But as we all know now, no, trauma is truly a global societal problem that we have to spend more time, dedicated monies, talking about the government now. We have to, as clinicians, we got to get on Capitol Hill. We got to get involved in the government to let them know, hey, you all are not allocating enough money. You all are not. Now, the final statistics that I was, it still just my soul to this day. But 50% of the anxiety disorders, 50% of the anxiety disorders is incorporated in the 100% of people that are diagnosed. It was only until the 1980s that the American Psychiatric Association gave PTSD and trauma its due, so to speak. That is when it was put in the statistical manual. So now we have a little more credence as it relates to what trauma does in a person's life because it's diagnosable now. So now what do we do now that we know we can diagnose this disorder? Now we as clinicians, we have to lend ourselves more to making sure we're doing what? The right kind of diagnosis. And you have various professionals that are able to diagnose, of course, psychiatrists, psychologists, social workers, licensed practicing counselors. But what I want to encourage today is when we're going to step into all of those statistical things that I've just told you about trauma, let's step into it, you all, in an expert manner. I'm known as Ask Miss Emma, the trauma expert. Now, I'm Ask Miss Emma, the trauma expert. I consider it both experientially and theoretically. Theoretically, because I have a bachelor's, master's in clinical social work. I also have a doctor's degree in clinical psychology. Now, experientially, I have experienced trauma, both past and recent present, in a medical situation. But before I share that story with you all, let me just share some quotes to you. Carl Jung says, I am not what happened to me. I am what I chose to be. Peter A. Levine says, trauma is a fact of life. It, however, does not have to be a life sentence. Rosenthal said, trauma is something that you don't choose, but healing is something that you can choose. Now, after I share a personal story that's going to help you understand further how trauma presented itself in my world, and why I think I am so very committed to making sure that I can impart whatever assistance, help to help people learn how to triumph over trauma. Well, when you have to triumph over trauma, one of the things I decided to do was to take that challenge and that call to write a book. And I'll talk to you about that further in here. Now, my trauma story consists of a little girl around 5 or 6 running through the woods. And guess what? Bullets were going over her head. Well, ask Miss Emma, why would bullets be going over her head at 3 a.m. in the morning? Well, glad you asked, and I'm going to tell you. There was a drunken father. The drunken father was attempting to do the most heinous act that I, at 5 or 6, could even think of. He was trying to sexually abuse my sister. But I had this fierce, fierce teenage brother at the time who foiled the father's attempt to do that. And in him foiling the father's attempt to sexually abuse our older sister, the drunken father became enraged. And I remember vividly, as you will when trauma presents itself in your life. It's a re experiencing of sorts. So even when I talk about it, it comes back to my memory at present date at almost 60. Yes, I remember that drunken father saying, you stay right there. I am going to kill you, you son of a. Well, This fierce brother, still not backing down, he hurries all of his family members, and it was 8 of us to be exact. He hurries us into the woods. And this 5, 6 year old girl as I am, I'm so petrified. I stop running. And momentarily, this fierce brother, he kneels down and he says, I got you, baby girl. It's gonna be okay. And okay it was. This fierce brother, I was dragged through the woods 2.5 miles to safety to my dear aunt, beloved aunt. She's gone now, to her home. And safe I was. So that trauma past parallels as well the recent medical trauma I had in Aruba in November of 2021. In November of 2001, you all, asked Miss Emma did what? She had a heart attack in international land. Yes. And when I came and I had to get back home, of course, and that happened on 11/27, the heart attack, 12/2, I'm in the hospital being medevac back to Washington Hospital Center. 12/6, I am stabilized and I undergo what? Open heart surgery. And from 12/6, just 4 miraculous days later, I walked out of the hospital. And there you have it. Trauma both past and present, recent present, November through December. So, you all, trauma will impact your life. As Rosenthal said, it is not a choice. I didn't choose for bullets to be going over my head. I didn't choose to have a heart attack. So even though I didn't choose these things, I chose to heal. And in me choosing to heal, my wellness for self is for somebody else. That's a tweetable. Let me say that one more time. My wellness for self is for somebody else. Because guess what? In all of that author stuff that I've been doing, the very first one, I am a survivor. Another one I did, you are enough. I am enough. I am enough and I am a survivor. And my intent, my wellness for self is for somebody else. Hence, my commitment to help tens of thousands of people learn how to triumph over trauma. Well, asked Miss Emma, how are you going to help people triumph over trauma? Even though you feel like you are experientially and theoretically a trauma expert, well, I am going to share some golden nuggets with you all today. And again, it's to inspire, encourage, and to just give you the roadmap to success, one roadmap to success, because I am clearly aware that there are other people in this field that are dealing with trauma and doing so in a great manner. I just have I have a few things that I'm going to share with you, but I want to share these 3 golden nuggets. The first thing that has to happen, you all, when you want to deal with trauma, you have to ask yourself the question, am I living my best life? Well, when you ask yourself that question, am I living my best life? I want you to think in terms of your job, your family, particularly your children and your wife, or your mate if you're not married. I want you to ask yourself that question and then be mindful and intentional about answering it correctly. Another thing that I do, and I will share with you all later, I have created a trauma checklist, not a trauma checklist, but a trauma questionnaire. And there are other ones that are just on the internet. Once you've asked yourself that question and you answer it honestly, and you feel like you do need some assistance, you're going to need to, number 2 nugget, reflect, reject, and reset your mind. Now, what is the reason, Miss Emma, that I would need to reflect? Well, you need to reflect on your life from that previous question I just told you to ask yourself. Am I living my best life as it relates to my family, my job? Because trauma will impact all milieux of your life, your spirituality, your family, your vocational, your employment, it, your health, both mental and physical. So that is the reason you would need to reflect. And as you reflect in answering question number one that I posed to you as a golden nugget, you then must learn to reject. You reject that I am not, that I'm gonna not, that I'm gonna keep not living my best life. You get to reject that because remember, Rosenthal said, trauma is something that you don't choose. Healing, however, is a choice. So now that being the case, I want you also to think about how am I going to do that? Reflect, reject, and reset. Well, you're going to do so by using evidence based psychotherapy. And herein lies where I think that I'm contributing in a vast way to this big global problem. I want to impress upon you all that evidence based psychotherapy means just that. They have been tried and proven. They have research. They have efficacy, validity, reliability. Now, in my book, I cover all of this, but I want to cover some of it with you all here today. Now, the first one that we need to talk about in terms of the psychotherapies would be CPT. There's a second one that we call EMDR. There's another one, PE, and then there's another one, trauma focus, CBT. So now when you heard me earlier say CPT, what I'm talking about is cognitive processing therapy. Cognitive processing therapy is an evidence-based therapy whereby you will have a clinician and she will walk you through 12 sessions whereby you're literally going to use cognition is simply your thoughts. She's going to walk you, he or she will walk you through those thoughts that are related to triggering things that happens that leaves you paralyzed sometimes, similar to me in the story when I told you I just froze. And so I had to be, helped. There was assistance. So I parallel that to evidence-based psychotherapy. This is more in depth, but you will need assistance. Those 12 sessions should be done by someone that's trained and know how to do so. Now, when you heard me say EMDR, what we're talking about is eye movement desensitization reprocessing. Now, what does that mean? Well, this is where you're going to have two types of treatments that's going to be included. And this too is like an 8-phase process, but I don't have a set number for that like we did for the previous one. Because sometimes in the EMDR, these sessions can go beyond 8 or 12 sessions. Now, the reason they will go beyond that is because sometimes, all the time in these sessions, you have to include both the behavioral and the cognitive part. So this is like a cognitive and behavioral piece combined. So cognitively, yes, you have to process what has happened to you, whatever trauma it is, whatever lane it falls in. And what they're going to do is in the behavioral part, those things that you've spent most of your life just trying not to deal with, they're going to have you to deal with it. But guess what? You're going to have assistance with you. So again, it speaks to the fact that you have to have someone that knows how to implement these treatment modalities, this evidence-based psychotherapy. Now, the next one we want to talk about is PE, not physical education, but prolonged exposure. And prolonged exposure psychotherapy is really just that, you all. Processing those thoughts that affect your feelings, then to your outcome behavior. In CBT, which is all of these are based in cognitive behavioral therapy, prolonged exposure means that you're going to process these massive thoughts that intrude and invade on your life and disrupts your marriage and disrupts relationships, disrupt job, disrupts just practically everything in your life, and could be physically, because some people commit suicide. Yes, there's a percentage of people that get diagnosed with PTSD. The anxiety becomes so much for them that they will check out. So, again, the brevity of this major societal problem needs to be dealt with. And again, I'm keeping the plug of politically, we have to get more involved as clinicians because we really need to just keep hammering. There needs to be more funds allocated for this. Now, with prolonged exposure, that's exactly what it means. You're going to process these traumatic experiences. And once you process these traumatic experiences, what I like about the prolonged exposure therapy is that you really get a chance for the therapist to assess pre and after. So before you get started, you'll do an assessment in terms of where you are. After you've processed these traumatic experiences, towards the end of it, when you're actually going through various, like for example, if you're a person that does not like to be around anyone that yells. Well, see, that's something that's kind of like basic in our society, especially if you get around kids. So loud noises and yells is something that could trigger you. Well, if that be the case with prolonged exposure therapy, you're going to process that stuff. And one of the things that you're going to learn is that this yelling is different from the other yelling. It's just that the trauma was so severe that when you hear any any variable that's closely related to it, it kind of like just takes you off your track. So, with that being the case, you all, prolonged exposure psychotherapy is yet another way for you to resolve trauma. Now, the fourth one, trauma focused cognitive behavioral therapy, is oftentimes the one that's used with children. However, in my clinical practice, it kind of depends which one I'm going to use. Because, for example, if I have a 25 or 30-year-old person who's emotionally thwarted, stuck in 15, 8 years old, according to Erickson's psychosocial stages of development, that's the stage where identity versus role confusion and diffusion. For example, if that person's trauma happened during that time, I may actually start with trauma focused cognitive behavioral therapy with that person because she's chronologically and adult age, but emotionally where she's stuck, there's incongruency. And so in the treatment, and I've had success with it because I've been in my practice for the last 15, 16 years, but I have 3 decades of work in the field. And so what I have discovered is that I get more success when I deal with their trauma on the emotional level that they're stuck. And I will use Erickson's psychosocial stages of development to help me with guiding my therapy. Also, Erickson did lots and lots of research where his is concerned. So again, evidence-based practices is what I generally will use to help my clients that has trauma. So trauma-focused cognitive behavioral therapy, prolonged exposure therapy, eye movement desensitization reprocessing, and cognitive processing therapy are the four psychotherapies that I go in depth more in my book. So, with that being the case, you all, that's the treatment part. So, when you think in terms of trauma going forward, I want you to be okay also thinking in terms of the treatments that I have just shared with you. And to remember that when you have a therapist that you're considering, you want to make sure that you interview that therapist. You want to make sure that that therapist has at least 3 to 5 years of experience, implementing these very specific evidence-based psychotherapies. And we, as clinicians, we're okay with you asking us those kinds of questions. And if you meet a clinician that is not okay with you asking them those kinds of questions, oh, absolutely, you do not want that therapist. And please forgive me, my peers, if I am stepping on your toes, but I don't think I am. If you have trauma that's unresolved, it's vital that you connect with someone that you have connection with. And what I mean by that is we all know that when you meet someone, there's a something that you feel innately about whether this is going to be something you want to try or not. And so I want you to think in terms of interviewing the clinician that you want to walk you through this very sensitive and traumatic experience called resolving, coping, or managing your trauma. Now, I have the book that I have that goes in depth. I'm also going to give away to anyone that would go to www.hmocs.org, or you can email me at info at hmocs.org, and I'm giving away that trauma questionnaire screening that I created. And if you endorse 3 to 4 of those, that is highlighting that you have some things that are unresolved. And if you want to get the book, you can certainly purchase my book from my website, www.hmocs. So, in conclusion, as I recap, I have a, I have wanted to serve you in a way that I have brought forth an awareness in you, and even my fellow clinicians or any other professional that is listening to me right now. If you have unresolved trauma, your wellness for self is for somebody else. In me dealing with my own trauma, I know that that is one of my connectivity to the very difficult population that I deal with, because I am not ashamed of my trauma that I have gone through. My trauma and what I have gone through, all of it has culminated in a way to this is the person that you have before you today. So, yes, I am totally transparent as it relates to my trauma and for any of my fellow clinicians, because in this field, as long as I've been in it for 30 years, I have run across a lot of professionals, professionals that have not resolved their trauma. And I'll give you an example before I go. Very good worker, very good worker, but anything that was considered to be uh, opposite of what that person wanted, it would just send them reeling. And it was just too much. And so one day, yes, I said, come on, let's go to lunch. And when we went to lunch, I said to her, I said, I'm just going to tell you what I observed. You are such a phenomenal worker, but it takes nothing for them to snap. And those of you all under the sound of my voice, if you have people that you know, or you're that person that you're just snapping, snapping, snapping at people, and you're not depressed or you don't have poor impulse control disorder, if you're one of those people or you know somebody like that, get them that free questionnaire that I have. Some of people that deal with trauma, they won't come forward. So they do require someone to check in on them. Now, the other thing, statistic that I forgot to give you all earlier was that oftentimes post-traumatic stress, that disorder, that trauma-related disorder, it can lend itself and to an increased level of pathology. Well, what do you mean when you say increased level of pathology? Well, sometimes the anxiety can be so much people get depressed. Oftentimes, PTSD and other anxiety disorders are comorbid with, guess what? That old ugly D word, depression. And we all know with depression, there's that element of, suicide that makes all of us afraid. So it has been my absolute pleasure in serving you. If there are any questions of me, I totally welcome them. And I guess that's it for Ask Miss Emma, the trauma expert.
Hi, Emma Jane Orphan. This is Melinda Rai.
Hi. Is there
So,
any
hi.
questions?
Yes, thank you so much for your terrible presentation. Jane Orflit is the trauma expert. So here is the question from our audience: what is the most important thing that can be done to help someone um, who recently had a traumatic experience?
Well, one of the things, as I said earlier, you all, for those people who won't step out front and just do it on their own, try to take them to lunch or just say, let's go for a walk. And then just say to them, you know what? I met this lady. She was a trauma expert on the WYN conference, and she has a free questionnaire. And if you get that questionnaire for her, you can even go a step further and you can literally just give it to her. Because sometimes that embarrassing element that I talked about, you all, it is something that people won't get help for because they don't want people to know. So if you just get her that questionnaire, she then is in control of it herself. Because as I told you, Rosenthal says trauma is not something you choose, but healing is a choice. And so if you can get her that free questionnaire that I'm giving away, info again, info at hmocs.org. Just send me an email and I will send that to you. It's free. Give it to her or him.
Thank you so much, Emma. And you got really a very good hairstyle. I liked it.
Thank
So,
you. Thank
so,
you.
so, if you want to reach Emma Jane Outfit, just email her info@hmocs.org. So she can respond to that. So I think. So no more questions. Thank you so much for your wonderful and terrific presentation. So yes, if anyone have any questions, they can reach to your email ID. Thank you and
Yes.
have a great day. Bye bye.